Hi everyone, I am Dr. Anu and I am here to make pediatrics simplified for you. In this topic, we are going to discuss about dengue fever. Do you know that this mosquito has the potential to cause endemicity and also a lot of outbreaks during the rainy seasons all over the world? Dengue virus is a virus that is seen in almost every continent and is a huge threat to the human beings. So, in this module, we'll be learning about the pathophysiology and the ways in which this mosquito is being spread and also how it is going to affect the human body. In the subsequent parts, we learn about the clinical features and management of dengue fever. So subscribe to this channel and also follow and like this video to get regular updates on more topics from pediatrics. So let's get started. So we know that dengue is a rapidly spreading mosquito-borne viral disease and it's a major public health concern in tropical and the subtropical regions. And the agent is the flavivirus with the single-stranded RNA. So the dengue virus can be of four types: the dengue1, the dengue2, dengue3, and the dengue4. One thing we need to know is if the person is affected with dengue virus 1 or similarly 2, 3 or 4, the infection with this one serotype will confer lifelong immunity to the virus serotype. So it means that if a person is affected with one serotype, that person is not going to get dengue infection with that same serotype again in their lifetime. However, because there are three other phenotypes, a person can get a secondary dengue infection. So coming to the mode of transmission, this is a vector-borne disease caused by a female Aedes mosquito. So this Aedes mosquito can be Aedes aegypti or Aedes albopictus. So Aedes aegypti is the most common ones that is seen in the urban areas. So a female mosquito will lay egg in containers that hold water. So adult female mosquito, which are morning feeders or day feeders, will lay egg in the water bodies, and this egg has the potential to stay even for 1 year. If there is no water source, egg can remain without desiccation for nearly 1 year, and the eggs will hatch within a few days to months when it is covered with water. So if the mosquito lays eggs on the top of a water and then the water source is removed, if the egg is laying on a ground without a water, it can even stay up to 1 year, and when the egg comes in contact with water, it is going to hatch and it becomes a larva. This larva lives in water and they develop pupae in nearly 5 days, and the pupae will live in water and they develop into adult and they become flying mosquitoes in 2 to 3 days. And these flying mosquitoes are daytime feeders, so they come and bite the human beings in the daytime. So what are the factors affecting the transmission of this disease? So number one is the environment factor. So lifespan is influenced by the temperature and humidity. So as we all know, dengue is a virus which is spread by Aedes mosquito, and this Aedes mosquito breeds mostly in the rainy seasons when the water is abundant and also the humidity is favorable. So it breeds mostly in the domestic man-made water receptacles. Coming to the host, all ages of both gender are at risk. So both male and female are at equal risk and any age is at risk. Secondary infection is a risk factor for severe form of illnesses, and the geographical spread of dengue has been reported mainly because of people traveling from one place to other. Coming to the dengue transmission cycle, so you know that a mosquito takes a blood meal from the person with an acute dengue, and this is going to stay inside the dengue mosquito, that is the Aedes mosquito, and the virus infects the midgut and eventually travels into the salivary gland. So this blood that is being drawn from the person who is affected with dengue is going to have the virus. This virus enters the midgut and then comes to the salivary gland. From the salivary gland, when the mosquito bites the second human, one mosquito can infect even up to several humans, and then they stay inside the body and the symptoms will usually take 4 to 7 days to appear. So coming to the pathophysiology of dengue viral infection, So the course of illness is characterized by 4 phases: early infection, dissemination, immune response, and viral clearance. So first phase is the early infective phase, then comes the dissemination phase, then comes the immune response phase, and then the so let's look at the pathophysiology of dengue viral infection. So here you have a Aedes mosquito that is going to inoculate the dengue virus inside the human body. So once the dengue virus enters the body, the dendritic cell is going to uh, recognize this dengue virus, and then it is going to kill the cell. Also, it will give the antigen presenting cell to the macrophages, and the macrophages will produce T cells. So what happens here is both B cell and T cell immunity is being activated. The B cell activates and produces an IgM response, and the T cell will cause cell mediated cytotoxicity. So this is what happens in the primary infection. Now what happens when the person gets a second time of dengue viral infection? So what happens here? Imagine that we have dengue1 which is being affected first. Now if the person is getting affected with dengue2 for the second time, the body will realize that it is a dengue infection. Body has a memory that previously also this person has been affected with the dengue virus, and hence the body will try to recruit the dendritic cells and macrophages there to produce cytokines and destroy the cell. But however, because it is dengue2, it is slightly different from the dengue1. So when the body tries to bring the virus inside the cells to kill it, the body cannot efficiently kill it because it is not the same virus that had come there for the first time. So because of this, the body will take the virus through endosomes inside the cell, and then the virus will multiply there and cause secondary infection. Virus multiplies, and this is going to form a cytokine storm. So this is what happens in secondary dengue infection. So this is a process that is called antibody dependent reaction. So in infection for the first time, there will be an early viremia. So based on the person's status, so if the patient is nutritionally well, there is low cytokine production, if the host antibody has enough resistance, then the patient will have only a subclinical disease. If the infection is moderate, then the patient will have dengue fever. If the bite is having a high viremia, then the person can go into dengue hemorrhagic fever. So let's learn about the antibody dependent enhancement. So this is what we learned. So what happens when the secondary infection happens? The body will try to take the cell in. It will try to coat with the antibodies, but then effective killing is not happening. Also, the antibodies can enhance the uptake of the virions, take them through the endosome, bring them inside the cell, but then is not able to kill the organism. Because of this, there will be cytokine storm. So this is the major pathogenesis in a secondary dengue infection, which is called the antibody dependent enhancement. You all have to remember this term, antibody dependent enhancement. So cytokine storm is the pathogenesis in secondary dengue infection. So what happens here? There's a confused antibody, and then it will form leaky pipes. So a transient disturbance in the function of the endothelial glycocalyx. So because of this viremia, it is going to affect the endothelial glycocalyx. Imagine our endothelium is like this. This endothelium is being coated by a smooth shiny thing called the glycocalyx. Now the virus is going to affect the glycocalyx structure. So because of this, an anti-NS1 antibody will act as an autoantibody, and it will cross-react with the non-infected endothelial cell and also the platelet. So when the anti-platelet antibodies are formed, there will be a defect in the endothelium. Cellular continuity is lost, so there will be a defect. So through this defect, capillary leakage will happen and plasma leak occurs. So this is the pathophysiology. So remember two terms: confused antibodies, leaky pipes. So the other features that you can see in dengue includes coagulopathy. So coagulopathy in dengue is mainly because of increase in APTT, fibrinogen levels decreases, platelet level decreases, DIC, enhanced fibrinolytic activity and release of heparin sulfate and chondroitin sulfate from the glycocalyx. So you know that dengue can be presenting with thrombocytopenia. So dengue is the major differential for any patient who presents with fever and thrombocytopenia. So the cause of thrombocytopenia includes number one is IgM type of antiplatelet antibodies, antiplatelet antibody plus complement causing platelet lysis, dengue viral specific antibodies, bone marrow hypocellularity, destruction of platelet in the liver and spleen, DIC, cytoadherence, and platelet dysfunction. So here we learn the pathophysiology. So we will summarize everything. So whenever the patient is having a mosquito bite, dengue virus will enter the body and cause incubation and inoculation. Then there will be viremia. So because after the viremia, there will be direct cellular injury and indirect cellular injury. Direct cellular injury will cause endothelial damage, macrophage activation and platelet destruction. Indirect injury will produce antibodies and T cell activation. Antibody dependent enhancement occurs, and because of that, there will be complement activation and cytokine storm. So this is going to form vasculopathy, cytopathy, coagulopathy, and organopathy. In severe dengue, this is going to clinically manifest with shock, massive bleeding, multi-organ failure, and severe complication that can increase the mortality. So in this video, we learnt about the pathophysiology of dengue virus. In the upcoming video, we'll be learning about the clinical manifestation, the lab investigation, and the management of dengue fever. So this is a very important session that you need to understand before coming to know about the dengue fever physiology and the clinical features. So knowing the pathogenesis is utmost importance, because only then we will be able to efficiently treat the patient. So in the upcoming video, we can see the further details. So please like and share this video with your friends, and also subscribe to our channel so that you will get early notification on the upcoming dengue videos and also regarding the other tropical fever. And you can post your doubts in the comment section, and if you want further videos on pediatrics, you can mention that also in the comment section. Thank you for watching.